We know testing is a key pillar of everyone's resumption plans across the country. And last week you heard the expanded test criteria was announced for Saskatchewan's residents as part of a strategy to limit the spread of COVID-19. Today, through our public service announcement, we provided more details on the changes the public can expect in the next coming days and weeks. Starting on May 25th, Saskatchewan residents can call Healthline 811 to determine if they can be referred for testing based on the additional expanded testing guidelines. There will still be policies and processes, especially with respect to how we will test patients inside our healthcare facilities in the upcoming days and weeks, and we will continue to communicate on those changes as our testing continues to expand across the province. We expect the full implementation of testing to occur in phases over the coming days, as I've already pointed out, and weeks to come. Regardless of the testing criteria, we are urging the public to continue to monitor for symptoms and utilize the self-assessment tool on the Saskatchewan.ca COVID-19 website. We need to continue to take COVID precautions in place very seriously. Like everything with COVID, we are learning to be adaptive and responsive to what's emerging every week. One figure that we continue to monitor is the effective reproductive number, which we have shared with you before. This number reflects the average number of people one person with the virus in Saskatchewan is likely to infect at the current time after you incorporate the effects of interventions that are in place. An effective reproductive number consistently below 1 means that the virus is being managed effectively through preventative measures. This past week, our models have been further enhanced to incorporate more real-time data in Saskatchewan, resulting in a clearer picture of what the ERN, or the effective reproductive number, is in local areas, particularly the far north and north. The good news is the effective reproductive number has continued to decline in the far north and north. It is now 1.87. I want to caution that this number can change, and given the increased number of far north cases today, we are cautious and we will remain vigilant. For the rest of the province, the effective reproductive number remains relatively stable at 0.62. And that again is a reflection of the vigilance that all of you following preventative measures, and shows us why we need to stay together as a province in our collective actions to continue to flatten the curve while finding our way forward in our new world. Your actions are making a difference, and we thank you for this. I'd like to now open the floor for questions.
We'll move to the question and answer portion of the call. There are no reporters with me in the room, so we'll go to the phone lines, please.
We have Lisa Schick with CJME.
Hi, I am wondering, this seventh death, where specifically did that person come from? What town in the north?
So I'm not able to share those details at this time, and generally we don't disclose identifying details in any case.
There are other jurisdictions that are doing that. They're being transparent. They're saying where these people are coming from. Why are you choosing not to do that?
Well, I think we continue to monitor how different provinces are disclosing their data, and we have, if you go to our dashboard, we have improved substantially the amount of information that is available, but we still feel that it is important, especially during times of hospitalization and death, that we as a government and as a health system have to do our utmost to protect the privacy and confidentiality of people and families who are going through a very difficult time.
Take the next question, please.
We have Mark Smith with CTV.
Hi, with so many businesses reopening on Tuesday, why not make the expanded testing available immediately? Why wait till next week?
So with the expanded businesses opening was not the primary reason only for expanding testing. So the number one reason why the expanded testing criteria will be put in place next week is so that we can prepare the staff at 811 Healthline for the proper understanding and workflow associated with the expanded targeted guidelines, because they are extensive. And until that's in place, it would be essentially a free-for-all. So this is why we want some time to actually get 811 prepared to do that. As I already brought up as well, the expanded testing criteria will continue to evolve, as will the work we will do as an organization to prepare our staff, physicians, and all those coming into our facilities to understand how they will access testing as we do this. To keep in mind, our major focus of testing access has been 811 around some of the broadest criteria in the province or in the country with respect to symptoms required to access a test. Now that we've expanded it, we want to make sure that our 811 supports are in place and well-trained on the new workflow before we actually open it up, and that's why we're doing it.
Is there a follow-up?
Yes. After some relatively low case numbers over the past week, how concerning is the 21 new cases today, and what do you attribute that big jump in cases?
Well, I'll start, if that's okay. I think, to my point around what's happening in the north and the comment around completing our active case finding and throughout that community, we knew we were going to find cases because of the work that's being done. I'm frankly not surprised by an increase in cases, especially in the far north and north, where we've expanded our testing criteria and the work that's being done on the ground to do risk assessments and to support people. And I think that people need to realize that this is going to be our norm for months. We will see days of 1, we will see days of 2, but we are going to see case numbers like this come up and down. I think the good news is it's in an area of the province where we are actively seeking and expanding testing and aggressively contact tracing, so it shouldn't be a surprise that we're finding more cases. But if Dr. Shahab had anything to add.
Thanks. Scott, so and I just want to add a bit about what we've seen, and I'm not talking about specifically about the 21 cases announced today, but generally what we see about transmission dynamics. So like Scott mentioned, when we have an outbreak and we do active case finding, we certainly test more broadly than we would otherwise, maybe everyone in a household, everyone who may have been a close contact, and that finds many cases who may have very mild symptoms or in some cases no symptoms. And that's always a good thing to do it during an outbreak, because that helps you then isolate and contain each case you found. And in many situations in the Northwest, what we have found is many new cases have no further contacts because they were identified as a contact, were already isolated, and if they became symptomatic or otherwise they were tested, and if they were positive, they recovered within 2 weeks with no further transmission. But the other thing that we have to remember from the reopening context is we've already seen two things in the last 2.5 months. We've seen that as essential services continue to work, as in phase 1 medical oriented services reopened, as long as the protocols are followed around physical distancing, use of other PPE as required, you get very little transmission. But on the other hand, we've also learned, primarily before we went into a lockdown, that you can get rapid transmission in settings where we don't observe physical distancing. So, Scott mentioned the effective reproductive number. It's less than 1 because of physical distancing. We do not infect more than 1 person and the epidemic dies out. But there are settings that we've seen in the past through large gatherings and any gatherings, in fact, where 1 person may result in transmission in 10, 15, 20 people. And so I think that's something that we need to keep in mind constantly. Obviously, there's a lot of interest in people having some group events now. Our gathering limit is still 10. In the future, that may relax a bit for indoor gatherings and a bit for outdoor gatherings. But we have to be mindful that as long as we maintain physical distancing and isolate when we're sick and seek testing that further informs what we should do and what our close contacts should do, this pandemic can be controlled. But when we are unable to do that, I think we see some transmission, and then we have to course correct in terms of what is the setting for that transmission and what further feedback can we give in terms of minimizing those events happening going forwards.
We'll take another question from the phone lines, please.
We have Creedon Martel with CBC.
Hi. If I have I'm looking for a bit more information, about the death. You mentioned that it's not going to be revealed specifically where in the North region, but I'm just wondering if you could give us a general location. Like, is it in the North Battleford area, maybe the Meadow Lake area, or the Lloydminster area? Is that something that can be revealed?
So, I will not be giving that information for the primary purpose that death happens, unfortunately, due to factors related to age and underlying risk factors. And when we look at our 7 deaths, actually, in general, what I can tell you is that as of today, there were 2 deaths in the 60 to 69 age group. There were 2 deaths in the 70 to 79 age group. and there were 3 deaths in the 80-plus age group. So while we've had 600-plus cases, unfortunately, deaths happen in older age groups. Having said that, in other jurisdictions, they have rarely happened in younger age groups. So no one is immune from serious outcomes and deaths. But generally, while we want to prevent transmission in any setting, we especially want to protect those who are more vulnerable in long-term care facilities, personal care homes, people in our households who may be older or may have underlying risk factors. So I think those are the principles that we need to remember. And there's no public health purpose served by me disclosing the location of a death.
Is there a follow-up, Creedon?
Yes, this is regarding the testing numbers. It's been, I guess, relatively low this week compared to previous weeks. It's been a couple of days of 300 plus test numbers. I guess, what effect will that have when the expanded testing comes in? Is the province expecting to hit a certain target for testing numbers with that, or what's the plan?
I'll start. Is that okay? So the first thing I'd like to say is around our testing strategy overall. And I would say that the testing strategy that's been deployed throughout the pandemic in Saskatchewan has served us very well, including how we've been able to adapt our testing strategy to deal with concerns on the ground, particularly with outbreaks in hospitals and or in the community, as in the case of La Loche, and it has been responsive. So with respect to the expanded criteria, and I'm assuming you've seen the public service announced with the broad expansion of testing criteria, it's pretty wide open, and don't have an idea of how many folks will come in. I'm not, at this point in time, given the fact that we've always had significant capacity that we haven't used, and as you've heard Dr. Shahab speak a number of times about the testing numbers, we're seeing low testing numbers in areas outside of the far north where we're targeting it and some of the outbreaks because we're not seeing people with symptoms show up, even though we have probably one of the broadest symptom checklists. If you have the sniffles, you can go in for COVID testing. So there is no target, but we do see and expect there to be significantly expanded numbers over the next weeks and months of continuing to test people across the province. Did you have anything to add?
I think the other thing that I like to just say is that we also need to not just expand testing, which we are, but also evaluate what further information we get from that, because in March, February, March, our recommendation was if you have fever, cough, shortness of breath, and you have traveled, seek testing, because we knew that's where we need to focus on. And then we started saying that if you have mild symptoms, you stay home and you can seek testing if you require. But otherwise, because cough and cold season was very common, and even though we had a lot of testing around the 1,000 mark, our test positivity rate never went above 2%. So I think it is important in the late part of winter to recommend testing in a very targeted way, with a very specific way. But then even as we expanded the criteria, because it is cough and cold season, our test positivity rate remained low, below 2%. And even now, although our test numbers are not low by any means, around that 300 to 500 mark, they're still respectable testing numbers. Our test positivity rate still remains very low. It's for rural and central locations, it's less than 1%, 0.3, 0.4%. For Regina, Saskatchewan, around that 0.8, 1.2%. So that again reassures us that there is not a lot of COVID activity, but that's exactly the reason why we hope that with this expanded criteria and making it even easier to get tested, people will seek testing during the summer when coughs and colds are otherwise uncommon, for this long symptom list that basically most people will not think twice about that, and they'll just think, well, it's maybe just something, virus I've caught over the summer. But if you do choose to get tested, it will be easily available, and that will inform you about, do you have to take any additional precautions to keep yourself and your household members safe. But it will also inform us in terms of, even with this widened criteria, are we seeing any COVID activity that we would have otherwise missed? And then once fall comes, obviously we'll evaluate what we've learned over the last 2-3 months, and then we may have to refine our testing criteria again, depending what we are seeing once cough and cold season starts.
Can we have another question from the phone lines, please?
We have Zach Visera with the Leader Post.
Hi there, Saskatoon Star Phoenix actually. But I'm phoning, I was hoping to ask about the expanded testing to mobile work sites, high volume work settings as they're described. How will that testing be rolled out and how will that work?
So it's a good question, Zach. We have not worked through all the details on how we will apply that testing, whether or not we will be showing up directly at work sites or whether we'll be grouping work sites for testing at assessment centers. That's part of the work to come. But we haven't worked through all the details around how we will operationalize it.
Is there a follow-up, Zach?
I do have a follow-up. Scott, you mentioned there earlier that the outbreak that is continuing in the far north highlighted the importance of addictions and mental health services for you. I wonder if you can expand on that and explain how that fits into the broader picture of testing for COVID-19.
Well, so I would go back to sort of that three-legged stool that you've heard Dr. Shahab and the Premier and myself talk about lots with respect to testing, aggressive contact tracing, and of course, abiding by social distancing and good hand hygiene and all those sorts of things. So as we go through some of the challenges that we're seeing in communities across the province, it's how do we put supports in place to support that community to meet the needs of the virus and to help contain it. So that includes things that are being done with cross-government agency participation up north with respect to including self-isolation areas for folks that are having, that live in certain circumstances where they can't do that. We also know that folks with mental health and addiction disorders are also struggling to meet some of the guidelines around social distancing. So with respect to the mental health supports, you already are aware of the managed alcohol program that has now been put in place in the Laloche community with the closure of the liquor stores. So it's trying to look at health from multiple different aspects, not just from the COVID-19. We've also got mental health supports, both through dial-in mental health supports, but also on-the-ground mental health supports and addiction supports in the community and in the far north to help support with that, like we do across the rest of the province. But it's not something that's unique to the Laloche area. These are services that are available to residents of the province that would struggle with these types of things and other vulnerable populations, even in our larger centers.
Is there a follow-up, Zach? We'll go to the next question on the line then, please.
We have Matt Young with CTV.
Oh, hello. I got a question about the expanded testing. I'm looking at the criteria. I guess, are there certain people that you would say do not get tested right now to not overwhelm the system? Because it sounds like it covers really, just about everybody who has a cough. And I'm not saying that that's not right. I'd just like to get you to expand on that. Is there somebody or a particular group of people that you're saying, hey, look, we don't need you to come and get tested yet? Or is it kind of, if you feel like getting tested, give us a call? So
the first thing I would say is that if you have a cough, you should get tested right away. That's always been the case. It's one of the criteria. So if somebody has a cough or sniffles, that's always been the case. You should actually come in and access testing as soon as possible so that we can ensure that you are safe for yourself and for the community. With respect to the expanded criteria, are there any single groups that we would target as part of the expanded guidelines? No, we're opening up on the 25th. We do believe that there will be some special directions to some of our patients, particularly those patients that are immunocompromised that we simply might not want showing up at a testing center because it might not be safe for them. So we'll be working through other ways within our facilities and within our operations to do that type of testing. And we'll be communicating with those folks as they come up. And if they have questions, our folks at Healthline will be happy to answer them for them. But part of the opening up the testing capacity is to do exactly that. So we are prepared to test anyone within the criteria that have been announced today, starting next week. And if people have any questions around whether they have a sniffle or a cough, they should phone 811 Healthline today and get referred for testing.
Is there a follow-up, Matt?
Yeah, just a quick thing. I know that you said earlier that because of this expanded testing, you don't necessarily have or haven't produced a target of how many people you'd like to see get tested, but certainly have the goalposts changed in terms of how many people you want to see get tested within a certain length of time? Like, I guess I'm saying is, are you expecting those testing numbers to at the very least significantly increase over the next couple of weeks?
Well, it's a good question. So the first question is have our current testing criteria, which have been in place and I would say have served us very well as a province, have those testing criteria already restricted people from coming in to test? And I'm not sure how that could be given how broad they are. My second comment would be to Dr. Shahab's earlier point. One of the things we're trying to do around this increased testing, where we know our testing both, today and last week and the week before has a very low test positivity rate, which tells us that our testing is being done in the right ways. And we will be evaluating this expanded testing to see what happens. So regardless of what the number of tests is, whether it's 1,000 or whether it's 10,000 over the next month, and I'm not sure what the target, there is no target, as I've said before, but we'll evaluate those tests to see how useful they are with respect to helping us find COVID cases that we were unaware of, and to give us an understanding of, what potentially an asymptomatic population would look like. But again, I would say that the testing criteria is very broad, has a very, very low bar already, and we're not seeing people come in droves. And hopefully with the expanded testing criteria, we get a broader swath of individuals, but there is no provincial target.
Can we take one more question from the line, please?
We have Roberta Bell with Global.
Hi, my question is in regards to the recommendation coming down on masking. I was just wondering if we could clarify Saskatchewan's stance now that we're reopening on a masking policy or recommendation.
On mask use. Yeah.
So wearing masks if they're out and about or working. Is there like an official stance on non-medical mask wearing in public here in Saskatchewan as we go forward?
Yeah. So I think one thing that we have in Saskatchewan is space, and I think we have put that to good use, whether it's going out for a walk near where we live or even going shopping. We generally can go about our daily business currently while maintaining a safe 2-meter distance. So because of that, I think as long as you do not go out while you're symptomatic and you maintain that 2-meter distance, that has served us well. We have been able to extinguish the pandemic with those principles of physical distancing. Having said that, certainly in many jurisdictions where you cannot maintain that 2-meter separation reliably, a cloth or non-medical mask has the advantage that if you were to cough and you couldn't cough in your sleeve, you prevent droplets from going on to either land on a surface that can contaminate a multi-touch surface or on someone else who's within a 2-meter distance, and that separation can't be maintained. So yes, a non-medical mask is useful in those settings where a 2-meter separation can't be maintained. And if you feel that you are going out either shopping or in a setting where you want to maintain that 2-meter separation but you can't, then a cloth mask is a good idea. And also, as our businesses reopen, many retail environments where you can maintain the 2-meter separation. When we look at infection prevention and control, there are many hierarchies. One is, not going out to work or shopping when you're sick. That's the first level. The second is administrative controls. So what that means is that you wait in line 2 meters apart, and the retail environment will limit crowding, that they'll say, okay, only, this number of people can be in this retail environment at a given time. So you have to wait outside for a period of time, and some people are unhappy with that, but those are administrative controls, and also going shopping only one person per household to reduce that crowding. And then there are engineering controls, and we've all seen good examples of that in gas stations and grocery stores where there's a plexiglass barrier between you and the cashier, and then there's a desire to use tap more than the touchpad. So those are all engineering controls where, through engineering, you have a barrier so that you're still trying to maintain that 2 meter separation, but even if you can't, there's a barrier that protects you from the cashier and vice versa. And then, of course, the fourth and last, you have to do all those hierarchies as much as possible. But the fourth principle is then use of a mask or other personal protective equipment. So in those settings, a non-medical mask is good as long as both people are wearing it in a personal care setting. In some environments, the provider, especially in the healthcare setting, may choose to wear eye protection and a medical mask. And in that case, then, because it's a medical mask, you are protected from the provider, and the provider is protected from you. Only one person needs to use PPE. So I think we need to just think through this, what kind of environment we're going into. And certainly if people feel comfortable wearing a non-medical mask when they're out or about, that's certainly a good thing to do. But it doesn't mean that you then don't observe that physical distancing principle as well. You still have to, that has to be the bedrock of our strategy, and that has served us well in Saskatchewan with our wide open spaces. But in addition to that, if you want to wear a non-medical mask, that certainly there's no recommendation against that, and you can and should do that if you desire to do so.
Do you have a follow-up, Roberta?
Yeah, just to clarify, so at the federal level, there is a, specific recommendation coming down on masking, and here in Saskatchewan, do we follow that, or what should people be doing here in Saskatchewan based on that specific recommendation from Theresa Tam?
Yeah, I think what we will see now in many cases is that when we are accessing retail environments or personal care services, medical and non-medical, we may be asked to wear either come, and certainly I and my family members have been asked to when we're going to certain environments where some medical services are being provided, to come wearing a mask. And then I think it's very important to comply with that requirement, because in that setting, the business environment is trying to make sure that if you're wearing a non-medical mask, and if you cough and you can't cover your cough, you're not contaminating the entire area, multi-touch surfaces, and you're also protecting others who may be sitting 2 meters apart, but just an extra layer of precautions. So I think all of us will have an opportunity, more likely than not now, to wear a non-medical mask, and that's a good thing, and we need to comply with those recommendations. And we will also see providers who would not have worn a mask 3 months ago wearing a mask, either in the medical field, medical-related areas, or also other personal care services, hair salons and others who have opened up now, and other business personal service providers that will open in phase 3. So I think it's getting comfortable wearing a mask where required, choosing to wear a non-medical mask if that makes you feel safer in a certain setting, and it's just getting used to that and getting comfortable with that. But having said that, I think most of what we do in Saskatchewan, either from a recreational perspective or from a business perspective, we still can and must maintain that physical distancing, attention to hand hygiene, not touching our eyes, nose, and mouth while we're out and about. And even for mask use, I think we should be thoughtful about how we put it on, not always fidgeting with it, because if you're not thoughtful about those things, that can be problematic as well.
That's the last question we have time for today. Thank you very much.